So our collaborative members span sectors, geographies, focus areas, organizations large and small, from city and state governmental partners, elected officials, healthcare providers, social services providers, philanthropy, and of course, small grassroots organizations and residents from across Central Providence. The CPO has facilitated, beyond the state investment, really an incredible level of statewide and national investment from outside the public sector. We are lucky to be a part of Blue Meridian Partners' National Place Matters cohort. Through this partnership, BMP has invested a total of over $10 million throughout the state of Rhode Island, including into the expansion and deepening of the HES model, and over $8 million in Central Providence neighborhoods in particular across our HES. We've been able to also leverage an additional $1 million in private funds just over the past year to support work in Central Providence, and $1.3 in 2023. We're also lucky to have the support of national technical assistance providers, including the Mobility Action Learning Network, which is a technical assistance program administered by the Urban Institute, specifically for advancing locally driven policies, programs, actions that boost upward mobility from poverty and address racial equity. I want to take a few moments to talk about our outcomes and that we're seeking and our theory of change. Moving on to the third slide there. In March of this year, we unveiled the Central Providence Roadmap, taking the work that had been done over the 6-ish years under the HES leading up to that, looking at what we learned, what we've done together as a collaborative, and crafting a 10-year vision for the next decade for health and economic equity that really addresses those structural conditions that are driving disparity in our 9 neighborhoods. The roadmap serves as a guide for our collective work. The development process, which spanned over 6 months, engaged all the HES partner organizations, members of our resident advisory council, and other community members to ensure that it was truly reflective of the needs that we see, the data and the lived experience, and the work that is currently underway by partners. The roadmap pairs the shared goals and outcomes with concrete strategies and tactics for achieving our shared goals. It's centered around the theory of change that if we invest operational, financial, and political capital into efforts that meet residents' foundational needs, and if we increase access to the drivers of mobility while building local power and capacity, then the conditions that drive health and economic disparities will improve. Obviously, a long-term vision. An implementation of the roadmap, which we begun soon after releasing it. By the way, I have some copies if you'd like some. We convene quarterly working groups, meeting under each of our 6 North Stars. That would be on, I think it's the 6th or so slide there. Those are housing, health, education, employment, business with the emphasis on small business, and community power. Those working groups are composed of community advocates, service providers, practitioners, and local organizers to align on priorities, mutually amplify each other's efforts, and to build deep relationships across organizations. Under each of these outcomes, as you'll see in the roadmap, we're tracking indicators that will help us over the next 10 years and beyond to assess and demonstrate progress. I'll also note to the conversation earlier that we also make sure we collect stories and qualitative data to really pair that with the qualitative information. And we're also working to build the data capacity of all of our partner organizations to ensure that we can enable data-driven decision-making. It's certainly an area that is important to all of your questions that you had for Chris, and it's also a big area of need and a gap for many organizations, especially super small organizations, but also larger ones, in order to effectively utilize program measures to drive learning, program improvement, process improvement, particularly around collaboration, and tie those to overall population level indicators. So that's incredibly important work that we and other HESs are actively working on. The roadmap also serves to align investments across our 9 neighborhoods by providing a community-developed blueprint for neighborhood improvements and align strategic goals. This, for instance, enables more collaborative fundraising by our CPO HES member organizations, coordinated engagement and advocacy, and can even form a guide for city and state governments if they want to understand the priorities and the work of organizations in Central Providence. For instance, just last week, we joined with the South Providence and 02907 HESs to host an event to gather input on the City of Providence's 10-year comprehensive plan, which is underway right now. We hope that through our input, the plan will address social determinants of health and create land use patterns that will improve upon the conditions that we see. So that remains to be seen, but we're actively positioning the HESs to do that type of advocacy and policy work. I want to highlight just a few initiatives and some of our recent accomplishments in tandem with the systems change work that we're doing related to the roadmap. We also manage initiatives that build what we call community infrastructure, not your typical like neighborhood physical infrastructure, but the community infrastructure that supports community organizations and residents. And build civic engagement capacity. One of those that you might be familiar with is the 9 Neighborhood Fund. This is the $1 million participatory budgeting initiative that we've ran over the past year. We also had partners in Pawtucket Central Falls who had a parallel process. This pilot initiative is made possible through RIDO, through some federal dollars allocated by the state, added to some private money to reach an even $1 million. Through this process, we collected over 350 ideas that residents had for how to improve community health in their community. We worked with community residents, including high school students at Mount Pleasant High School, to whittle down those 350 ideas to the 20 that appeared on the ballot. And then from voting that occurred in June, we now have reached projects 4 large projects and 3 small projects that are currently in the implementation phase, including nearly $370,000 for parks improvements, including a pilot of composting toilets in Morino Park, something the city has been seeking to try out, and this is an opportunity for them to pilot it and assess it. $330,000 for lead water filters for households throughout the HES, targeting those that are likely to see elevated lead levels in their water. $50,000 for peer mental health training. This is an issue across the state, our HES in particular. Over $130,000 to add amenities, including shelters and seating at local bus stops. So this initiative not only helps us to advance the goals of increasing civic engagement by changing voting attitudes, but we also hope that this institutionalizes resident involvement in government funding and budget decision-making, brings them indoors such as these. I won't go through all the details of the other the other projects that I list on our current initiatives pages, but I do want to mention that along with RIDO, we have worked to expand the number of community health workers throughout Central Providence, providing training, certification, and pre-apprenticeship to bring community members and their expertise, their insight in to help residents navigate their own health needs. That's about 40 residents that have gone through those programs over the past few years. We have the first free community wireless network in Rhode Island, in Olneyville, something that we're always willing to talk about and help to expand to other communities if helpful. And we've worked with a lot of our partners to pilot new ideas that might not have been funded otherwise. One that I want to highlight, given the challenges around childcare in the state, is the SCIU Education and Support Fund partnered educator-led community of care. This is a child care provider-led initiative to launch family child care networks to really support the providers of in-home child care, develop their skills and business capacities, and their leadership and advocacy skills. This was a project that was recently featured on a call with the White House. We were excited to be able to join and share that work, and it has since expanded to a few other states in the country. We also offer business supports to local businesses as employment providers, as drivers of mobility throughout Central Providence, including the Biz Bodega, which we call our front porch for small business owners and entrepreneurs in Central Providence. We see other folks from across Providence come for the resources there as well. And I also want to highlight the Central Providence Community Loan Fund, which offers accessible, low-interest loans to small businesses and nonprofits. We operate that with the Providence Revolving Fund and a community-led loan committee where we give loans to recipients up to $20,000. These are super accessible for folks who might not be served by traditional lending. Lastly, affordable housing. This is what you likely know One Neighborhood Builders as providing, but I just want to note for a moment that we're deepening our work across Rhode Island. We've submitted plans to Rhode Island Housing to develop or preserve over 280 rental homes across 4 municipalities, comprising 5 projects. All of these are located in health equity zones from Cumberland, Central Falls, East Providence, and in Central Providence. All of these investments are going to pay off in communities and for government. A new report that we commissioned and worked on the community continuum of care in Rhode Island with the Providence Community Health Centers shows that the average Medicaid-related health care spending for persons who were formerly homeless, who are now living in permanent supportive housing, was consistently lower than Medicaid recipients who continue to experience homelessness. So, in essence, affordable housing pays off for everyone. I just want to thank you for your time. I'm happy to provide further details on anything that I've shared or anything that I did not share from my deck or presentation. I look forward to your questions and input and to my colleagues' testimony.
Anusha, thank you very much. There'll be some questions. We'll come back in a minute.
Okay.